All right, so let me introduce this second assignment. So last week I introduced Horos, and you had an opportunity to just play with it a little bit, to experiment with some of the different features and to export some JPEGs. And so what we're going to do in this assignment is we're going to utilize Horos to generate some reference illustrations that we're going to use to create a finished anatomic illustration. We've discussed some of the advantages to Horos before. I think, when I went through my lecture about imaging technologies, but just to kind of repeat that, kind of drive that point home. One nice thing about using Horos to generate anatomic references is that you're viewing data from an actual living person. And the more you look at these data sets from Horos, the more you realize that a lot of the illustrations that you see in atlases are not exactly accurate, because all of those old anatomy atlases were originally drawn from dissections of cadavers. And the preservation process and just the fact that the cadaver is laying on a table, it can kind of alter the location of things a little bit. So using this Horos imaging data, you're getting data from a real living person. So you're seeing the way these things are organized in an actual living person as opposed to a preserved cadaver. Now, still, you have to take into account the fact that oftentimes these people are laying down, especially for CT and MRI, which are the majority of the studies we use. They're laying down. So there may still be a little bit of distortion, but it's still probably more accurate than what you'd find in most anatomy books. One of the other huge advantages to using a program like Horos to generate reference images for anatomic illustration is the fact that you can view anatomic structures from any angle you want. If you rely entirely on Netter's Atlas, Grant's Atlas, the TEMA Atlas, all of the popular anatomy atlases, you're pretty much limited to straight-on anterior views, posterior views, lateral views, and an occasional cross-sectional view like a sagittal or coronal or an axial view. But here in Horos, you can reconstruct these things in 3D and view them from any angle you want. So if there's a relationship between structures that's difficult to see in a straight anterior, posterior, or lateral view, you can actually orient anatomy in an unusual angle and paint it. Use Horos to generate a reference image, so you can then paint that anatomy from this unusual angle. You also do have the ability to crop the anatomy in any plane. So if you're looking for cross-sectional anatomy and it just so happens that your Netter or your Grant's Atlas or whichever atlas you have doesn't have a lot of cross-sectional anatomy, you can generate a coronal or sagittal or axial section at any level that you want in the body. And then finally, another big advantage to Horos is the fact that it's especially useful in the medical legal field, where attorneys are going to want images that are drawn from their patient's specific anatomy, from their client's specific anatomy. So as long as the injured person or whoever the client is, as long as they have access to their imaging data, you can then use that imaging data to create a very accurate image of that person's specific anatomy. So what we're going to do, just as an overview in this project, is we're going to export some JPEGs from Horos, and we're going to try to view some anatomic structures from an unusual angle, the kind of angle that you wouldn't see in a typical anatomy textbook. So what I'd like you to do first, when you get started on the project, and there may be some time to start it today, because hopefully I won't talk the whole time. Certainly, we'll get to this in a minute, but you're going to have a couple of whole class periods to devote to working on this project in class, just so that I can be here to give you feedback and help with any questions you run into. But at some point, hopefully today, you can start going through some of the data sets, either going back and exploring things like Visible Human Project or Cancer Imaging Archive, or using the data sets that are on the course's file share, and find a data set that really interests you, that has some anatomic structure that you think is really interesting. And then you'll position that body into a non-standard view. So I don't want any straight anterior views of the body or straight lateral views or simple sagittal planes. I mean, you can use the cropping tool, but then orient the body into one of these non-standard views. And you're going to want to then export some JPEGs from Horos. Now, there's multiple things you're going to want. One requirement for this assignment is that I want to see the skin. I want to see the outside of the body of the patient to help orient us to the internal anatomy so that we can see the relationship of the internal structures to the external skin. So at some point, it could be the first JPEG you export, it could be the last JPEG, I don't care how you do it, but you're going to want to export a JPEG of the external skin surface of your patient. Now, it doesn't have to be the whole body. Of course, most of these imaging studies aren't the whole body, they're only one part. So if you're focusing on some anatomic structure inside the head, just export a JPEG of a rendering of the skin of the head and the face. Obviously, if you're in the thorax, you can just do export a JPEG of the skin of the thorax and so on. So you're going to want that skin surface, and then you're going to want most likely multiple JPEGs of the anatomic structures you're interested in, because let's say you want to look at some feature of the heart, for example. You may want to export a JPEG where you see the external structures of the heart, but you may also want to do a cut section into the heart. So you may use the crop tool and do most likely a coronal plane section into the heart so you can see some of the internal features. Plus, you may also want to do separate exports of JPEGs of some of the surrounding structures like the rib cage and the sternum and any of the bony structures that are going to be around the heart. So you may export 3, 4, 5 different JPEGs. Try to keep them all in the same orientation, because you're going to want to illustrate the anatomy inside the skin outline. So you don't want the body to be rotated in one direction to do the skin outline and then rotate the body in a different direction to do the anatomy, because then the anatomy won't be oriented correctly relative to the outside of the body. So you're going to want to keep them all in basically the same orientation. And of course, you're going to use some of the tools that I showed you last time to be able to adjust colors and transparencies of the JPEGs. Window level tool and the 16-bit color lookup table editor can be used to change colors, but also to change the transparency of structures, which is going to be particularly important. If you're trying to look at something that's deep inside the body, you need to make part of the body transparent, or use the crop tool or the scissor tool to cut away any structures that might be in the way of your anatomy that you're looking for. So ultimately, you'll end up with a handful of JPEGs that you've exported from Horos. You're going to bring those into Photoshop, and you're going to use Photoshop to paint a nice anatomic illustration of the anatomy using those JPEGs as reference. And I'll show you some steps in how to do that. I know we have some people who are either just learning Photoshop or maybe haven't learned Photoshop yet. I didn't think to talk to Alan Giesek in the grad computer applications class and tell him that several years ago, I had actually switched the order of that class to teach Photoshop first, to make sure that I was teaching Photoshop in the grad computer applications class at the same time that we were doing this project. Then I discovered that he went back to the old way and he's doing Illustrator, which would be great for the stuff we're going to do at the end of this course, but not so good right now. So I will walk you through a demo of how I work in Photoshop, and hopefully that will be enough to, get you on your way with painting in Photoshop. And for those of you who took computer applications, the undergrads who took it maybe 2 years ago, this will be a good refresher. And I know people are going to be tempted to use other programs. A lot of people just love Procreate, and I have no problem with Procreate. If people want to paint in Procreate, that's fine. But please listen to my warning. When you, I don't know why it is with Procreate. I don't know if the settings are hidden somewhere and they're kind of obscure. People don't know where to find the settings, but the problem I run into with, there's two problems I run into when people work in Procreate. Number one, they end up creating the artwork really, really small, and they don't realize it until the very end when they bring it into Photoshop and realize, oh shit, this is supposed to be 8.5 by 11 at 300 pixels per inch, and instead I get 3 by 5 at 72. And it's like, guess what? Throw it away and start over, because it's going to look like crap if you try to blow it up to the full size and the full resolution of the master. So if you're going to work in Procreate, number one thing is make sure you know how to make the image the right size, the right physical dimensions, and the right resolution before you even start painting it. Okay, so that's warning number one about Procreate. Warning number two is that I don't use Procreate, so I don't know what features it has and what it doesn't compared to Photoshop. But the sense that I get from looking at people's work in Procreate is, you know, some people create beautiful stuff, but it doesn't seem to have the same path tools and selection tools that are available in Photoshop. And the beauty of paths and selections in Photoshop is the ability to create an outline around the object that you're painting, so that when you paint it, all of your paint stays in the object that you're actually painting, and you don't get like a lot of extra paint spraying out into the margins, you know, out beyond the edges of the thing. So one of the things I see frequently with people who work in Procreate is a lot of anatomic structures that have very poorly defined edges. They're very soft, very fuzzy. They blend into their neighbors. Now there are some tissues that do blend into their neighbors, but there's a lot of things like if you're drawing the vertebrae, I want to make sure every vertebrae is nice and crisp and distinct from its neighbors. Right? It should have nice, crisp, hard edges. And I find that super easy to do in Photoshop. If you can do it in Procreate and keep nice, crisp, hard edges, by all means, more power to you. I just see a lot of bad stuff in Procreate with a lot of fuzzy edges and you know, poorly defined edges on objects. So that's my little. I'm off my soapbox now. That's my little warning about Procreate. It's a wonderful program if you know how to use it. So I will walk you through a demo of how I do this in Photoshop. So speaking of the parameters that you want to meet for your project, I want the illustration to basically fill an 8.5 by 11 page. So you know, does the anatomy need to go right to the very edges? No, but I don't want an 8.5 by 11 page with a little postage stamp artwork in the middle. So use most of the available space. And it's fine if you orient it either vertically in portrait view or horizontally in landscape view. I don't care how you orient it, but it should fill basically an 8.5 by 11 page. Work in RGB color and make sure that your image is 300 pixels per inch. So fairly high resolution. Now, those two settings are a little bit contradictory because usually we use RGB color for something that's meant to be viewed on a computer screen, something that's going to be placed into PowerPoint or viewed on the web. And normally 300 pixels per inch would be a high resolution image, which we would only create something high res if we were going to print it. And normally if you're printing something, you're going to use CMYK color. But I'm not going to worry about that at this point. I want them to be high res, so they are, you know, high quality, very detailed images. But you can just leave them in RGB, you know, at this point. If you are working in Photoshop, you know, you'll be working in many, many layers. So you should make sure to save that layered version for yourself and save it as a PSD file, a Photoshop document file. So it's going to preserve all of the layers as well as any selections or paths or anything else that you create in the image. But for the purposes of submitting something to my courses, I don't really want your layered PSD files. I don't know, maybe I'll change my mind about that at some point, but for now, I just want you to save a flattened JPEG for submission. You don't need to submit the layered PSD files to me. Oh, and by the way, I think I forgot to mention that you should also label structures. Normally, I don't label anything in Photoshop. Normally, if I'm going to add labels, I would place the Photoshop file into Illustrator and add my labels in Illustrator, because Photoshop being a raster program, the labels are not nice and crisp. But for our purposes for this project, it's fine to put your labels right in Photoshop. So you'll have a couple weeks to do this. You'll have whatever time's left at the end of today to at least start exploring the data sets and start thinking about an anatomic structure. But then Wednesday of this week the whole class will be devoted to work time for you to just work on the project. And then the following Monday, we're actually going to do another assignment in class, but then the following Wednesday, you'll have another whole day to work on the project in class. Then it'll be due for critique exactly 2 weeks from today. Lexi? Yep, I'm going to show you a whole bunch of them. Okay, and when this is due on Monday the 13th, 2 weeks from today, please upload that flattened JPEG to my courses before the start of critique, so that I don't download 3/4 of them and then at the end of the critique realize that I got another 5 projects that were downloaded 12 minutes after class started. Okay, so let me open up some examples to show you what I'm thinking about. And the assignment has evolved a little bit over the years, so I may show you some that don't necessarily have all of the same parameters that I'm looking at. Specifically, there was a point where I added the requirement to have the skin on the patient. So some of the older ones may not have that. I'm just gonna kind of open these at random because I don't remember what some of them look like. All right, so there's an example. Oh, it's got a little bit of skin in it, not a whole lot. I'd probably like to see a little bit more of the body. But this one's very well done. Looking at the ribs and the costal cartilages and the vertebrae, everything has nice, crisp, clean edges. The arteries in here, the aorta and renal arteries and celiac trunk and superior mesenteric artery, all these things have nice crisp edges. So no fuzzy stuff in here. Everything's nice and clear and distinct. And then you can see, labels of the anatomy as well as a title. The title is optional. You don't have to have that. But, okay, I may have shown this one in a PowerPoint at one point. Another one focusing on arteries. Again, nice crisp vessels with nice sharp edges. No fuzzy soft vessels that blend in with their surroundings. The ribs look pretty sharp and crisp. Vertebrae look pretty good. So a very, very dramatic image. Notice the angle of the body creates just some visual drama. It's okay if you want to make yours dramatic. I mean, your illustrations, in terms of style, they can run the gamut. They can be more sort of dry and didactic, just the facts, ma'am, kind of thing. Here's the anatomy of this region, or you can create something like this at an angle, that's got a little bit more visual drama to it. Here's another one that's got some visual drama. We're looking up from below. Reminds me of this kind of an obscure movie reference, but the movie Citizen Kane. There's a scene at the end where I think it's Kane himself is like throwing a tantrum and throwing furniture around the room, and the whole thing is filmed from the ground up. So you're looking up at this guy having this tantrum. And it heightens the visual drama of an image when you're looking up at something from below. Plus the dramatic lighting in here really makes this for kind of a dramatic image. But you can again see just that little hint of a skin outline up there, and then of course the internal anatomy with the bones and the vessels. Now here's one that's a little different approach. I may have shown you this in the PowerPoint too. Very, very different style. It's not as fully rendered, but that's okay. You still there's enough rendering here that you have a very nice sense for the form, the shape and form of the different structures. The relationships of those arteries to the bones is still nice and clear. The edges of the bones, if we zoom in here, you see how everything has nice crisp edges. It's almost like an ink drawing. But I forget how she did this approach. I don't know if she just did that right in Photoshop or in Procreate to create that sort of ink drawing look, but the result is really nice. Just very different style than what we've seen before. Okay, this one doesn't have a whole lot of anatomy in it. Although, this particular student really wanted to focus on the dura and the folds of dura and how the folds of dura create the dural venous sinuses inside the head. So you've got superior sagittal sinus, inferior sinus, great cerebral vein, straight sinus, and so forth. So, it's definitely capturing some useful information, again, from a kind of a non-standard view. And then you can see the little faint outline of the skin outside the head. Let's see, here's Xian's from last year. She just graduated this past year. So she went into a little bit more detail with the skin. She captured this photo of the skin from this particular data set and actually rendered a little bit of the skin. But then down here inside the body, the skin is all transparent, allowing you to see all of the anatomy internally. And, really nice job on this coronal section through the lungs. She may have been able to just export, 2 JPEGs, one of the skin and one of the thorax cut and coronal section, because you notice that the bones are also cut in that same coronal section. But it's also possible she may have done a separate export from Horos, just to get those vertebrae and the ribs in there. Another one similar to the one of the head ones that I showed you previously that's got a little bit different style. Again, notice the dark outline around everything. It gives it almost like a little bit of an ink drawing quality. But then all of your detail and texture in your 3D form is concentrated here in the area of interest. And this student was focusing on the relationship of the atlas and the axis to the occipital bone of the skull. So you got the occipital condyle up there, number 7. You got C1 here, with the transverse process over here at number 6. You can see 4, which would be the dens or odontoid process. Even got the little hyoid bone floating down here in the neck. Let's see what else we got here. So this is an earlier one before I had students add the skin outline, but this is one where this student obviously did a JPEG of the external structures of the heart, and then use the crop tool to cut a coronal section of the heart and exported another JPEG of the cutaway view of the heart. Just a couple more, I'll show you. So here's one where, again, we've got the skin outline, and you can see that you can actually see a lot of the recognizable facial features, but they're partially transparent, allowing the internal anatomy to show through. So this probably required at least 3 JPEG exports, one for the skin outline, completely opaque, one for the bones, and then a separate one for the arteries. And then she used, transparency to be able to reveal all of those things at the same time. Another one from before I included the skin outline, but another dramatic view, looking up from below, up towards the base of the heart, or the apex of the heart, and looking up at the underside of the liver, and of course, kidneys and bones. Everything's, very nicely rendered, nice crisp, clean edges. And I think that's about it. No, maybe one more here. right, here's another one of the head. You know, this student had a little fun with the skin color, but it actually works pretty well because it helps, you know, show the transparency of the skin to reveal a skull inside. It's, you know, nice job rendering the bones and the sutures, and you know, nice job on the vessels, giving them kind of a 3D appearance. All right, so those are some student examples. And I also want to show you some examples from my own work, because I want to show you, you know, kind of the inspiration for the project and some of the applications of Horos, you know, in the real world, you know, working on real projects for clients. All right, so I had a project. Let me actually show you the finished project first. I was working with a orthopedic surgeon at U of R, and just a little background about the project. He was looking at measuring relative proportions of different parts of the body in young children and seeing if there was any particular measurement in the child that was a good predictor of the final adult height of the individual. And to do this study, he actually had access to a data set. I forget exactly where the data came from, but might have been an orphanage or something like that, where they kept detailed records of the growth of these kids all the way pretty much from when they were infants right up to adulthood. And they measured like all these different measurements of, you know, what's called, you know, overall height or standing height, and head height, which is from the external acoustic meatus to the top of the head, and body height, which goes from the pelvis to the external acoustic meatus. You see all these different measurements that are labeled here. I mean, notch height, which is the height of the jugular notch of the sternum off the floor. So anyway, so he had all of this data, what they call a longitudinal study, where they followed these kids, like I say, basically from infancy to adulthood. And so he was able to then determine if there were indicators in very young children that would tell you or allow you to predict someone's final adult height. And I'm not sure exactly why that's important, but I know he treated a lot of kids with scoliosis, so it may have had something to do with that you wanted to be able to tell, okay, how much more is this kid likely to grow? If we're going to fuse their spine for scoliosis, you know, how much potential height are they going to lose as a result? So it may have had something to do with that. But so anyway, he wanted this illustration that included the lateral view of the skeleton and with that body outline around it. And you'll notice here that there's kind of a two-part figure here on the left where we show the skull, the whole vertebral column, rib cage, pelvis, and then you see the thigh bent as if the person's in a sitting position. So there's one set of measurements where the person's in a sitting position, but then the femur and thigh gradually come into view down here, and we also see the rest of the lower limb all the way down to the floor, and there's a separate set of measurements where the person is measured in a standing position. But so I was able to combine all that into one. Another view of, lateral view of the skull here to show some of the measurements in the side of the skull, external acoustic meatus and C1, there's a certain distance there. But he also wanted anterior views of the thorax here, because there's this notch height, and anterior view of the pelvis because there's a symphysis height, the difference from the sacral promontory of S1 down to the level of the pubic symphysis. So this is basically what he wanted. And in order to create that and to make sure it was really accurate, my first inclination was to just photograph my skeleton at home. And everybody has a skeleton at home, right? At least most medical illustrators do. So ignore the little Trump mask in the back. Ignore the little Trump guy back there. My daughter bought that as a gag gift for me for Christmas one year. And I didn't realize that I was capturing his face in the background of my images. But anyway, so I'm photographing the skull here and photographing the neck and the shoulder, and down here, lumbar vertebrae and pelvis and so on. Of course, just go down the whole length of the skeleton and femur, because I wanted to be able to illustrate these bones in lateral view, and so I needed good references for them. The problem that I ran into with this approach of just photographing the skeleton was that everything I was getting, all of my references were in this sort of perspective view, where you imagine, my eye is kind of centered right here about the middle of the shaft of the humerus. And as I look straight across at the, lower part of the thoracic spine and the rib cage, I'm basically looking straight across the body in a straight line. But as I look up towards the scapula and the humerus and the upper part of the rib cage, I'm really looking up at those structures from below. I mean, that's really obvious up here. You look at the acromion, I'm looking at the underside of the acromion, and way up at the top of the skull, I'm looking at the base of the skull. And then the opposite is true as I look down from this point of view. I'm looking down at the top of the pelvis. I can see the right ilium here, but I can also see the left ilium just, barely make it out there in the back. And so there's this problem of perspective view. So again, just to create a little schematic of this, is if this is my eye, and I'm looking at part of the skeleton, say I've got the sternum here, and I'm going to draw like a side view of the skeleton. So sternum and manubrium and xiphoid process, and then of course we got various ribs wrapping around the thorax, and then we've got different vertebrae here in the back. I know that there's actually a anatomic relationship that sits right here at what's called the sternal angle, which is the junction between the manubrium and the body of the sternum. That level of that sternal angle between those two things lines up with the level of the T4 vertebra posteriorly. And anatomically, there's a lot of important things that happen at that level, such as the arching of the aortic arch inside the thorax, the junction of the left and right brachiocephalic veins to form the superior vena cava, the bifurcation of the trachea into left and right main bronchi. So the trachea would come down and split into left and right main bronchi. It's getting all cluttered in here because there's all this important stuff happening at that level. So if and I'm actually going to show you an illustration where I needed to show that relationship between these different structures that all line up between the sternal angle and the level of T4. The problem is, if I'm trying to photograph that with my digital camera, like I did with the skeleton, when I look straight across at the body, I'm looking in a straight line. So things in this part of the sternum are going to line up perfectly with structures in the vertebral column. But as I'm looking up, I look up at that sternal angle, and my line of sight is then going to carry me up to the T3 level. So from this perspective view, it's going to look like the sternal angle lines up with T3, not T4. And likewise, if I look down, this way, I'm going to be looking way down here at, T12 or L1 or something like that, way down in the lower part of the vertebrae. And I'm going to be looking down into, if this is the pelvis down here, if that's ilium, I'm going to be looking down into the pelvic cavity from above. So the reason I'm mentioning all of this is because it's one reason why it's really hard to work from photographic references like this, because the camera is always going to give you this kind of perspective view. So I thought, okay, there's got to be a different way to do this. And that's when I thought about Osirix or Horos. And I'll show you this in a few minutes. I'm going to actually go into Horos and show you how I would export my JPEGs for this project. But I'm also going to point out something else in Horos. In Horos, you actually have the ability to choose between a perspective view, like your eyeball or camera, or you can also choose what's called a parallel view. And in a parallel view in Horos, when you're looking at a bunch of anatomic structures, it's as if you've got a whole bunch of eyes at every level of the body that are always looking perfectly straight across. So the green lines represent the perspective view, where you've got like basically one point for the observer, and you're sort of looking up, looking across, and looking down at the body, depending on which way you're looking. But then the parallel view, shown here in purple, is where at every single level, it's as if you're looking perfectly straight across at the body. So the beauty of that, of course, is that, looking at my sternal angle up here, my sternal angle would line up perfectly with T4, which would line up with the bifurcation of the bronchi and the arch of the aorta and so forth. So everything would be lined up the way it's supposed to be. So as I said, I will show you in Horos how to make sure that you've got that selected properly. So this is a parallel view of the lower part of the pelvis and the upper part of the femur. And then I could, move down and take a close-up of the distal femurs and the patella and the proximal part of the tibia and fibula, and I could do the same thing from a lateral view. I could even, zoom out a little bit and see more of it at once. So here I've got the whole pelvis, the whole femur, all the way down to the knee, but I'm always looking straight across in that parallel view. So there's no distortion as I look up at the pelvis or down towards the knees. And so I did this, for all different parts of the body, and ended up doing it for the upper body too. I had to pick a different data set. Here's a mechanics data set to get, sternum, ribs, vertebrae, and so forth. There it is with the anterior part of the rib cage and the sternum removed. Okay, so by exporting a whole bunch of JPEGs out of Horos, I was able to actually create an entire lateral skeleton, an entire anterior skeleton, and these are all, this is all in Illustrator. And I was showing this to the grads recently. I think I showed them this same image, and while I was at it, I made sure to group everything so that, whoops, not so much that. Don't show that example. If I need the whole cervical spine, and lumbar vertebrae. All right, I got to go back and fix this because it's not grouped the way it's supposed to be. But you see a lot of things are grouped, and I'm losing some of the detail on the sacrum. All right, not working the way it's supposed to. But what this allows me to do then is to, if I need an anterior view of the skull in Illustrator for any reason, I just grab it, copy and paste it into another file. Of course, that's got the cervical vertebrae too. But, so I created this entire skeleton, anterior and lateral, really just for my own purposes, so that I always had all of these bones illustrated if I ever needed them for anything, and then use them, to as a basis for this illustration for the client. So that's one use of Horos, or Osiris. Here's another one. Open this up in Photoshop. And this was actually the sort of inspiration for this project. And it was also the first time that I really understood the value of that parallel view setting in Horos versus the perspective view setting, because this is an example of an image showing exactly the kind of thing I was trying to sketch out here, showing the fact that in this illustration, I needed to make sure that the anterior structures of the skeleton, the manubrium of the sternum, the body of the sternum, the xiphoid process, the costal cartilages, the anterior aspects of the ribs, they had to line up perfectly with the vertebrae in the background. And you can see I've even got the outlines of the thoracic vertebrae visible in there. Plus, all of this stuff had to line up perfectly with some of the internal anatomy. So we've got the heart sitting in there. We've got the apex of the heart, which usually sits in the fifth intercostal space, which it's in the fifth intercostal space down here between ribs 5 and 6. The arch of the aorta sitting right back there at the sternal angle, which lines up with T4, and left and right brachiocephalics joining together to form superior vena cava, and maybe a teeny bit high. That's a little bit above T4, but it's pretty close. And then there's some other anatomic relationships there too. So so this is one where it was really important that I think I've got I took a bunch of references from 2 different sets of data. So here's a data set called Anonymics, and I'm playing around with transparency. Here's one where you can still see a lot of the muscles and some of the soft tissue, and you can just kind of see the sternum and ribs in there. Here's one where things are a little bit more transparent. Even the sternum's starting to disappear a little bit. The costal cartilages have largely disappeared, but you get a better view of the heart sitting inside the thorax. Then I started using, I think, the crop. Yeah, I used the crop tool here, cut away the anterior part of the rib cage, and it's even starting to cut into the ventricles of the heart a little bit. Then continuing to crop deeper. Now I can see the posterior parts of the ribs. I can actually see clearly into the left ventricle of the heart leading up through the aortic valve up into the aorta. And similar view, but with things, more things transparent. And here's the skin edge from that particular data set. Here's another one that's cropped a little bit deeper, so the whole heart is cut away. You just see a little remnant of the descending aorta here. And then did something similar with a different data set from mechanics. So I was actually using two different data sets in this particular project and just comparing them, making sure that what I was illustrating matched both data sets. So if I go back and open up the finished figure again, oops. If I pull up my layers palette, you see I got some layers for the text. Hide those, got some more layers for text. Hiding all the text layers. I got my signature in here, leader lines, boxes, outlines of the vertebrae. They wanted the nipples in here. That wasn't my choice, but they wanted that as yet another surface landmark for internal structures. So we got that, and we got a little wisp of skin here. If you just stuck the nipples on there, you couldn't really see them. So I had to have that little bit of skin behind them so that the nipples were a little more obvious. So those are on separate layers. And then we've got, all the other different parts here. We got the costal cartilages on their own separate layer. Sternum on its own separate layer. And if you're familiar with Photoshop, you might notice on some of these layers, costal cartilage, sternum, ribs front, cannula, that this little white symbol next to the sort of thumbnail of the image, that is a layer mask, which I love layer masks. Layer masks are your friend. I'll demonstrate that when I walk through this. We'll take a break and then I'll walk through that. But so sternum's hidden now, and then we got the anterior part of the ribs, which are rendered separately from the posterior part of the ribs. Here's the cannula, which is, that's what this project was all about, was the positioning of this tube through the right internal jugular vein down into the SVC, the right atrium, and the IVC. So they're hiding that, and then we got, cutaway of the right ventricle. We got the rest of the heart. And at this point, all we got left are just the back of the ribs, intervertebral discs, vertebrae. And here are my different reference images that I used for that. So I've got, one skin reference from that anonymics data set. I got my vertebral bodies and intervertebral discs and the posterior elements of the ribs. I've got reference for external features of the heart. Another heart one. I think this is one where we start to get into the interior of the heart. So if we look at my view of the heart, it kind of lines up. Mine's a little higher in there, so I didn't match the references exactly. And then this was for the anterior parts of the ribs and the sternum. And actually, while I have this up here, let me just show you one other thing. To create all these anatomic structures, like the vertebrae and the discs and the back of the ribs, I created a whole lot of pads. So there's a bunch of paths here. So there is a path for outlines of all the vertebrae, and maybe kind of hard to see at the moment, but if I select those paths and move them, you can see I went to the trouble to use the pen tool in Photoshop and actually draw paths around all these vertebrae so that I could then convert those paths into a selection. And that would allow me to get nice, crisp, hard edges around my vertebrae. And any painting that I did would be limited to the interior of the vertebrae. So if I don't have my vertebrae visible or my intervertebral discs, let me hide everything. I could create a new layer here. And I'll walk through this again more slowly in a minute, but I can take this path for the vertebrae and turn it into a selection. And then if I find a bone color, I can go up to the edit menu and choose fill and just fill that entire selection with that bone color. And then while it's still selected, all I got to do is go in, paint highlights and shadows on it, and I got my vertebrae done. And so, even though these vertebrae are, fairly detailed, there's a fair amount of texture and form on them. You probably do that. I mean, I've done this before. I have a little practice. So, you could probably render all these vertebrae in, I don't know, hour or two. So as long as you approach it methodically, you can actually crank this stuff out pretty quick. So that, need that. I'll skip. Oh, all right. I'll show the PSD file for this. I think I showed this in a PowerPoint. We had a copy of this. So this is, anterior view of the abdomen, focusing on the abdominal musculature. And again, it's built in a lot of layers. So we got a little tiny umbilicus. We got these nerves like ilioinguinal, iliohypogastric nerves. The superior and inferior epigastric artery and vein, they're kind of ghosted in there. Cut edges of the rectus sheath, and some of the striations on the rectus sheath and even on the muscles are painted in on separate layers. We've got one of the external oblique muscles. We got the other external oblique muscle, rectus abdominis. There's the whole rectus sheath, femoral vessels. There's the other rectus abdominis, costal cartilages on left and right, ribs, intercostal muscles. So now we're down to, just the pelvis down here. Pubic symphysis is a separate layer, right and left halves of the pelvis, and then I don't know why I called that inguinal canal, but again, this is all based off of anatomic references exported from Horos. So I got a bone layer, I got a muscle layer, another muscle layer, and I did this for a couple different data sets. So here's a different data set with bones and muscles, another view of the muscles. So, and same thing. If you look over in the paths palette, you can see that there's a lot of paths. Actually, let me go back and hide a lot of that again. You can see there's a path that I drew for part of the pelvis. Not the whole pelvis, but part of it anyway. You see the path here. And, same kind of thing where you can draw a path, make it a selection, fill it with your foreground color, and at least have a starting point for the overall shape of the bone. And then it's just a matter of, taking your brush tool and painting in your highlights and shadows to give it some texture and form. Not like that. Give it some bone texture. One last example from the real world that I wanted to show you. So you've seen some of this before also. these are these medical legal exhibits. So I've got this guy. Actually ended up replacing this orientation drawing with an actual likeness of him. I should make sure I bring the current versions. This is an older version of this again. But I think I've shown you this image before of the thoracic vertebrae, or at least from T2 down to T7. So this is all drawn directly from references from this guy's actual imaging data. And so they wanted that illustration of the normal anatomy. At one point in this case, they were convinced that the person's paralysis actually resulted from damage to the blood supply to the spinal cord. So they wanted me to show the thoracic aorta here, giving off the different arteries branches that actually supply the cord. So you see like a superior view with a cut section of the aorta with these left and right posterior intercostal arteries that then give off branches to the cord. It turns out later that they changed their theory about that, and so they didn't need that exhibit. And then we have his fractures, which I think I've shown you before, and the surgery where they did the surgery wrong and put the screws in at the wrong level and damaged the cord. So this is all based off of these different Horos references. So you can see I took a lot of reference images from Horos. And there was not very good data. The imaging data was not very good. So it really took a lot of tweaking with things like the 16-bit color lookup table editor and some of the other features in Horos to try to be able to see the different the fractures, especially. I mean, you can kind of see in here. There's I don't know if you can see what I'm pointing at with the cursor, but there's a transverse fracture right there through the lamina, through the base of the spinous process of T5. But like I say, I had to keep playing around with different settings. Here's a very different setting, but you can actually see the fracture pretty clearly right here going across the back of T5. And you can also see the little fracture fragment here in the vertebral body of T5. Yet another bunch of settings. Here's another one. Here's another one. You pretty clearly see that fracture right here across the lamina at the base of the spinous processes, as well as the fracture out here of the T5 vertebral body. So I actually numbered the levels so I could see them myself. You can actually see the fracture there continuing over into the right transverse process. And then I had some from a different data set that showed the blood supply, because remember I started out, I had this one exhibit showing the aorta and showing these posterior intercostal arteries that are supplying blood to the spinal cord. So this was a really nice data set, clearly showing those posterior intercostal arteries branching off and going back to the spinal cord. Again, just playing around with different rendering settings to see which ones captured that most clearly. And here's a view of the spinal instrumentation, just so I could tell the correct level for the placement of these pedicle screws and rods. And you can see all the interference in here. The data set itself is pretty ugly and was really hard to get clear views, but by really carefully playing around in the 16-bit color lookup table editor, I was able to actually distinguish the metal from the bone by color. So it made it a whole lot easier to be able to see the screws if I colored them in this kind of turquoise color. So anyway, so those are some real world examples of using Horos to generate anatomic images or references for anatomic images. So I'm going to stop the sharing. Okay, so what I want to do now is walk you through the process of how I choose and how I export my reference images from Horos, and point out that setting for parallel versus perspective viewing of the 3D model. And then I want to walk you through a demo of how I then paint these anatomic structures in Photoshop. And so first off, right off the bat, I was a little surprised to see that some of the data sets that I brought in here last time are still here. So I assume that means that these computers don't completely wipe themselves out and reset every single night. I'm not sure how frequently they do that, but usually I don't see the data here when I come back in after being away for a couple of days, but doesn't matter. I'm going to actually add another data set in here. I've already downloaded the mechanics data set, which is one of my favorites for thorax and abdomen structures. I downloaded that out of the courses share. So I'm going to drag that back in here, just drag it in, say copy the files. And so here's the mechanics data set. And I want to see the number of images. In these different sets. I guess I gotta, oh, there we go. And enlarge the window a little bit. So mechanics includes multiple studies, but this one here with 743 slices, 743 images, that's going to be a very large, very high quality image. So I'm going to select that one, go to my 2D viewer, and then from the 2D viewer, go to a 3D volume rendering. I don't think there's really any advantage to trying to use a surface rendering. I don't think you're going to get much out of that. So I think you're going to want to always use a 3D volume rendering. So here's our 3D volume. And I don't know yet exactly which internal structures I'm going to want to render in this person. So I'm not necessarily going to take a JPEG of the skin right away until I have a better idea what part of the body I'm going to focus on. But I'm going to zoom in a little bit. Maybe we'll look inside the thorax. So first thing I can do is just use my window level tool to make some of these structures transparent, make some of the soft tissue transparent. And we can look inside the thorax and start to get a sense for what's in there that we might want to illustrate. And I'm seeing a really nice view of the aorta and pulmonary arteries. So that might be a cool thing to illustrate. Let me grab my crop tool and we'll crop in. Oh, that's the posterior coronal plane. Here's the button for the left sagittal plane, so I can crop in and remove the ribs on the left side. Crop all the way in like that. And make sure to turn off the crop tool before I start moving around anymore. But that would be an interesting illustration right there. Because, normally when you see the the aortic arch coming off the heart, you might see it in a straight anterior view. Of course, doesn't help that the sternum's in the way, but or you might see it in a straight lateral view. Even this is less common. You don't see this view very often. But if we had a little bit of an oblique view, you can actually see very clearly how the pulmonary trunk comes off the front of the heart. It's coming from the right ventricle. Pulmonary trunk comes back, and up in here you can see the branching of some of the pulmonary arteries. And then you can very clearly see how the aorta comes up, gives off its three big branches. So brachiocephalic artery, left common carotid artery, then left subclavian artery, before then turning posteriorly and then turning inferiorly down to become the descending aorta down in the thorax. I can try to maybe crop away some of the sternum. Use this anterior coronal plane to crop away some of the sternum a little bit. Yeah, see, that's even better, because now I still got a little bit of sternum up there in the way, a little bit of the manubrium. But I can very clearly see that aorta. The brachiocephalic artery is a little bit hidden. I suppose I could tilt this back a little bit and we get a little bit better view up at the brachiocephalic and the left common carotid and left subclavian. And then, like I say, we get aorta coming down. So I think this is going to be pretty good. So I'm going to go ahead. I'm actually going to resize my window. Just drag the bottom right corner and drag this over. Maybe kind of reposition, recenter the body. The only reason for that, the only advantage to that is that you're not going to end up with all that excess black space around the body. So there we go. That crops off a little bit of the excess black space around the body. It doesn't really matter if this little cube shows up, but you can actually hide that cube just by clicking the orientation box here. And that hides that cube, as well as hiding some of the other text, which, we're not going to include that in our Photoshop image anyway, so it doesn't really matter. But I'm going to export a JPEG now. Say File, Export to JPEG. And we're going to call it something like, mechanics vessels. That pops it up in preview. I'll just close that. And if I take my window level tool, I don't know if I can get rid of I guess this may be a CTA. This may be, CT with angiography. So it may be very difficult to get rid of the vessels, which would be kind of nice to get rid of the vessels so that I could actually see the vertebrae and the posterior elements of the ribs without having any of the vasculature in the way. But it doesn't look like I'm going to be able to get rid of that. And I really don't want to reorient this image right now. Because if I start moving it around and rotating, if I try to go back and render the skin of the patient, I'm going to have a hard time getting it back into the same orientation. So once I start exporting JPEGs, I want to try to keep it in the same orientation. In other words, I don't want to rotate around and try to crop off the heart. Actually, maybe I can just use the crop tool. That might work. I can just see enough of that little circle. Maybe I can get rid of some of the vasculature and expose the vertebrae a little bit better. That's not too bad. So I could export a JPEG there. And we'll call this mechanics bones. And now I'm going to put all that stuff back on. Okay, why did it do that? Shoot. So now it's going to screw me up because for some reason the little green buttons disappeared. Still can't see the one in the front. It's going to let me. Nope. It's rotating it. Shoot. All right, well, I'm going to drag this left one over. All right, now I can see the one in the front. Drag that one out, put everything back on. I suppose I could do a JPEG here, although I don't know that I'm going to need this one. Call it something that I'll remember, like mechanics with ribs. But then I want to use my window level tool and put all the skin back on. And I wonder if it's still cropping some of the skin. Yeah, it still had a little cropping in there. All right, there's my skin. So I'll export one more JPEG for that. Okay. Oh, and I forgot to point out one of the really important things that I meant to show you. If I make this window a little wider, notice here in the upper right, there are two buttons for parallel and perspective view. That's what I was talking about before. Thankfully, the default setting in Horos is actually to view it in parallel mode. So if you forget to click the right button, it usually doesn't matter because normally we want parallel mode. Let me rotate this body and see if I can get a view where the perspective view is going to be obvious. Sometimes if you position the body in extreme foreshortening like this, when you turn on the perspective, you can really see the difference. So if I switch this from parallel to perspective view, I mean, it's not a huge difference, although you can tell that now the chest and shoulders is narrower than the hip and thighs down here, whereas in parallel view, the chest is actually wider than the hips. So with perspective turned on, we're getting the true foreshortening of the body, where things farther away are smaller. Now you may, I suppose if you're going for like an extreme dramatic image, you may actually prefer this kind of dramatic perspective versus, the parallel view, something like this. If you wanted to, you can actually see some of the muscles in here pretty clearly. So you can see things like rectus abdominis. In here, you got external obliques and intercostal muscles and some of the pelvic muscles down here, where you can, hide all that musculature. Look in here at some of the, vasculature coming down out of the thorax down here into the abdomen. And so here having the perspective on gives you this extreme perspective, extreme sort of foreshortening, which, makes for an interesting dramatic image. If we switch that to parallel, it actually looks kind of weird in this parallel view because you're completely lacking any sense of perspective in that view. So you can see here, there's a pretty dramatic difference when I switch back and forth. But the parallel view is especially useful, like I said before, if you're looking straight on at the body and you want to make sure that, that sternal angle, for example, which is up here where the manubrium and body meet, make sure that lines up with the T4 vertebrae in the back and the aortic arch and bifurcation of trachea and so on. So there are times when you definitely want that parallel setting and other times where Whoops, I actually have the perspective still on. There we go. In times where perspective may be more desirable, like I say, especially if you're going for that kind of dramatic perspective view. All right, well, let me quit out of Horos then. And here are the images that I captured. And I'm gonna open up Photoshop. In fact, I'll just drag these into Photoshop. And so it's opened up my skin layer, the vessels image, the one with the bones with a lot of stuff cropped away, and then the one with all the bones intact and everything in the thorax intact. So what I'm going to do now that I've got these things into Photoshop is I'm going to just copy and paste all these into a new file so that they all become layers in a new file. So I think I'll start with the skin. And I'm just going to select all. I'm going to select all, or Command A selects the entire image. Copy, or Command C. I'm going to now create a new document. And I'm just going to use what's in the clipboard right now. So when I copied that skin image back there, it saved it into what's called the clipboard. So it just temporarily saved it in the computer's memory. If I create a new file, which is the size of the clipboard, it means that when I paste that image in, it's going to fit in here perfectly. So now I'm going to say paste. And you see it drop that image in, although it put it on its own separate layer. So then I'm going to do that with each of the other layers. I'm going to do, say, the bone one. I'm going to select all, Command A, copy, Command C, go to my new file and paste, or Command V. And it should have pasted it right in perfect alignment with the skin. And then I'm going to do that with this one, Command A, Command C, go to my new file, Command V. And then what did I leave out? Bones, and then I think I need the vessels layer. So select all, Command A, copy, Command C, and paste, Command V. And some of you may already be familiar with a lot of the keyboard shortcuts, but I'll try to remind you of the keyboard shortcuts, just because keyboard shortcuts are a lifesaver. They'll save you so much time. Even just having to go up to the edit menu and choose copy or paste slows you down a little bit. All right, so so we've now got one image here that has all four of these as separate layers. Before I do anything else, before I start drawing anything in Photoshop, I have to realize that I don't know how big all of those JPEGs are that I exported out of Horos. My guess is that they are the wrong size and the wrong resolution compared to what I want for the finished product for this assignment. So before I start painting anything, if these things, if these JPEGs are really small and low resolution, if I start now creating paths and painting stuff in Photoshop, everything that I'm going to paint is going to be too small and low resolution. And so then I'll get to the end, and it's the same thing I was warning about with Procreate earlier. I'm going to get to the very end and realize, oh poop, I made everything way too small and low res. And now if I try to scale it up to the size that I really need, it's going to look like crap. So I'm going to go into the image size command here, image size window, image size. And here's where I can specify how big I want this thing to be. So let's see here. Let me cancel out of there real quick. This image probably will work best as a vertical image. I don't know. It's really kind of close. It's like I could make it landscape view like this. Yeah, I guess I'll leave it like this. I guess I'll leave this as a landscape view, where it's wider horizontally than it is tall. Some of these other images look like they really lend themselves to more of a vertical portrait view, but by the time I add all that skin outline and stuff, I think actually I'm going to be better off in this landscape view. So I'm going to go back to that image size. And so I want this thing to be roughly 8.5 by 11. I mean, ultimately I want it to be exactly 8.5 by 11, but I want to get pretty close here. So I'm going to say if it's 11 inches in width, all right, that means it's only 7.79 high. Let me go ahead and make it 8.5 inches high. The width is going to be a little too wide, but that's okay. I can crop a little off in width. And then I'm going to boost the resolution up to the resolution I need. Now, normally you don't want to scale something up that much in Photoshop, but the JPEGs that I pasted in here are not going to become part of the final image. So the fact that I'm scaling these JPEGs up to a very large size is irrelevant. It doesn't matter because I'm going to be repainting everything anyway. I just want to make sure that I'm scaling it up now at my rough sketch phase, before I actually start rendering the anatomy. All right, so this is close to 8.5 by 11. It's a little wide, and it's 300 pixels per inch, which is what I want. So I'm going to say okay. And I'm so tempted to do keyboard shortcuts. I try to avoid that. So you know what I'm doing. I'm doing Command-0 fit to screen, which allows it all to fit in here. And remember, this was a little bit wider than 11 inches. If I go to my image size now, it's more than 11 inches in width. It's exactly 8.5 in height. So I can go to my canvas size command and change this from pixels to inches. And so now, if I enter 11 inches in width here, it's going to crop in on the left and right, crop off some of that black space to make my image exactly 8.5 by 11 at 300 pixels per inch. So I'm going to say, okay. It's going to say, hey, that's smaller than your current canvas. Are you sure you want to do that? It's like, yep, go ahead and do that. But it shouldn't have cut off anything important. Just cut off some of the excess black space. All right. So, so now I got my reference images in here. So let me start drawing some stuff, and I think I'll start out with the bones. And yeah,
When you changed the image size for that one, did it change all of them? Like, I was wondering if you had to change like the size of every reference picture.
Excellent question. Ethan's asking if when I change the size here, is it changing the size of all of the images? Because I've pasted all 4 images into the same Photoshop file, when I change this, it's changing everything.
Oh.
Right. If I hadn't pasted them all into the same file, then I would have to do it separately on all 4. But they're all just layers in the same Photoshop document. So I have changed all 4 of them at the same time. Yeah. So. I'm sorry, I can't hear you. seems to be grayed out. If you go in, you have to go. That way. See everything on one screen. It'll duplicate it over here. All right, so I've got my images here, and I've played around with my Photoshop layout here. I do this in both Photoshop and Illustrator. I like to have certain palettes visible, and other things I just completely hide because I find them useless. So oftentimes I'll only have like my layers palette visible, my paths palette, my swatches palette. And if you don't see one of these, if like the paths are not visible, you can go up to the window menu, and any of these floating palettes you can bring back in here. So if I want my paths palette visible, I just choose it from the window menu. So there's my paths palette. So the way I work in Photoshop is I always create a lot of paths. I showed you that a little bit with some of the examples I showed you of my own work. And to create a path, you use the pen tool. And if I hold down on the pen tool icon, you can see that there are other pen tool options like add anchor points, delete anchor points, convert anchor points. There are also a couple selection arrows, like a white and a black selection arrow. These fortunately behave a lot like Illustrator. So if you've at least played around with Illustrator and tried mastering the pen tool, then hopefully you'll find this very similar. I'm going to zoom in, and I mean, there's a magnifying glass tool that lets you zoom in. You can hold the Option key down, and the plus magnifying glass becomes a minus, lets you zoom out. You can also hold down the Command key and hit plus or minus. So Command plus zooms you in, Command minus zooms you out. You'll see me doing something like this a lot. You'll see something pop up on screen. You'll see this stupid thing pop up on screen all the time, because since the beginning of time, Adobe has used standard shortcuts for zooming in and zooming out in all of their software. Command and spacebar lets you zoom in. Command spacebar plus Option lets you zoom out. And then somehow Apple got it in their heads that, hey, let's take those commands, those keyboard shortcuts that have been in Adobe since forever, and let's use them for something else. So now if you hit Command spacebar on a Mac, instead of just zooming in Photoshop, it brings up this stupid thing called Spotlight. On my computer at home, I have disabled Spotlight because I never use it anyway. I find it completely useless. So I've actually disabled the keyboard shortcuts for Spotlight, so that when I'm working in Adobe programs, when I hit Command and spacebar, I actually get the plus magnifying glass. So even if I'm in some other tool, if I hold down Command spacebar, I get the plus sign. Now like I say, you'll see me doing it all the time by accident in here because I can't change the keyboard settings on these computers. I can do it on my own at home. There is a way around it. If I hold the space bar down first and then hit Command, notice that I get the plus magnifying glass, and I can zoom in or I can zoom out depending on which way I drag. So that's what I want it to do. I just have to remember to hit the keys in the right order. Also, if I hold down just the space bar, I get a little hand tool that lets me move around. These things are so ingrained in me, I swear I probably do them in my sleep. I have my hand hovering over the space bar, the command key, and the option key, to be able to zoom in and out on the fly and hold down the space bar to be able to move around in the image. So my hand is constantly hovering over those keys, like right now. So anyway, so back to the pen tool. So there is, like I say, there's a pen tool in here that behaves just like the one in Illustrator. And so what I'm going to do is I'm actually going to draw a path around this particular vertebra, and I'm zoomed in so much I don't remember which vertebra this is, but looks like one of the lumbar vertebrae. Now, part of it's hidden here behind the left kidney, but I kind of know what it's going to look like, so I'm just going to kind of wing it and just make it up a little bit. And come up and around. And then when I get back to my starting point and I click on that starting point, it encloses the path. Now, if you look in my paths palette, you'll see that there's now something in here called work path. I want to make sure that I save this path and give it a name before I do anything else, because if I accidentally click in the paths palette, so the work path is no longer highlighted. See here, it's highlighted in gray, but if I click here, it's not highlighted anymore. If I start drawing a new path, it just wipes out the old one. So whenever I create a path, I always save it right away. So I've gone ahead and wiped that one out. Let me go ahead and redraw this path around this particular vertebral body. And now, before I do anything else, let me zoom out and see if I can figure out which vertebra that is. I think that's T12 because it's got a rib. Yeah, I think T12 is just above, so I'm thinking this must be L1. So I'm gonna double click on that, or I can just actually there's a little menu here in the upper right of the paths palette. I can say save path, give it a name. So we'll call it L1 body or something like that, and click OK. Now, even if I deselect that path or click out here so it's not highlighted anymore, it's still there, and I can always get it back by just selecting it from the paths palette. But I'm going to create separate paths for every vertebral body. And notice these vertebrae are overlapping because of the angle that we're looking at this in. These are going to overlap. I want to actually render these separately. I don't want to render them at the same time, because if I rendered them together, they would just kind of blend in with one another. It'd be hard to create that separation. So I'm going to call this T12 body, and then click in empty space in the paths palette to deselect, and then start the next one. These vertebral bodies are similar enough in shape that I might be able to just draw one and then kind of copy and paste it to create a whole bunch of them. But I don't know that I want to do that. Now, if I make a mistake, like I may have screwed this one up. I was following what I thought was the edge, but I think there might be more to that vertebral body. If I make a mistake, I can grab one of my arrows here. If I grab the white arrow, then I can actually select individual anchor points, and they've got little handlebars just like in Illustrator. And I can reposition the anchor points and tweak the little handlebars to adjust the path. Remember to name it. And I'll do just one more. Now, it's going to be a little bit of a problem because there was still that little chunk of aorta that I couldn't quite get rid of with the crop tool. So I got to kind of wing it a little bit up in here. Grab my white arrow. Just. All right, I'm not going to draw every vertebra. I don't want to take that much time. Why are there two here? All right, I seem to have screwed up and put two paths on the same path, or two vertebrae in the same path. So I'm gonna cut that, deselect, paste. Where'd it go? Where'd you go? Oh, don't do that. Huh. Oh, that's weird. Well, I screwed something up. I drew a vertebra and then lost the path somehow. I'm not going to worry about that. All right, so let me just go and select any one of these. Like here's my L1 vertebra. You know, to highlight it, to get it to show up, I just click on it in the paths palette, and I can now see the outline of it. And I could grab it with the black arrow tool and pick it up and move it around if I wanted to. Or I could use the white arrow. If I want to make any additional edits, just click on individual anchor points and move the anchor points around and tweak the handlebars. But once I get it where I want it, I'm actually going to convert this to a selection. And there are two ways to take a path and turn it into a selected area in your Photoshop image. The simplest way is just to highlight the name of the path in the paths palette. And then down here at the bottom of the paths palette is this little circle that looks like it's a dotted line. And when I hover over it, it says load path as selection. So when I click on that, it's going to turn that path into a selection. I frequently avoid using this, and I'll explain why, or I'll try to explain it. There's the other way to take a path and turn it into a selection is in the little menu here in the upper right corner of the paths palette. If I click here, there's actually a command called make selection. And when I bring that up, it's going to give me the option of turning that path into a selection, but it gives me the option of entering something called a feather radius, which means that if it's set to 0, I'm going to get a nice hard selection. But if I put a number in here like 12 and click OK, it's going to turn the path into a selection, but it's going to turn it into a soft fuzzy selection. And there's a thing called the quick mask mode where I can look at that, and you can see here that there's kind of a fuzziness to the edge of that selected area. If I were to fill this with, let me see, let me create a new layer. Oh, wait, sorry, I keep doing stuff without thinking, without explaining. In my layers palette, if I want to create a new layer, there's a little plus sign down here in the bottom right. Just click that, and that's going to make a new blank layer, called layer 5 here. Now, if I fill in this selected area with the fill color, I'm going to fill it in with 100% of the foreground color, which is this yellow. Notice how fuzzy that is? That's because of the feathered selection that I created. So I'm going to undo that. And I'm actually going to just deselect. I'm going to get rid of that selection. So I'm going to go back to my L1 body path. The reason that I don't like to click on this little icon down here to create a selection is because if I do that, it's going to remember the feather number that I entered the last time I made a selection. And if I simply click down here, it's going to give me that same fuzzy selection again. So that's why I try to make a habit whenever I have a path and I want to turn it into a selection, I actually go to the little menu here in the paths palette. I take the time and the trouble to go down here and say make selection. And I look at this and say, oh, poop, I don't want a feathered selection. I want a nice hard selection. So then I enter 0. So I always do this just to confirm that I'm not getting a feather that I don't want. So click OK. Now I've got a nice hard-edged selection on that vertebra. So now when I go to the edit menu and say fill, I fill it with 100% of that yellow foreground color. I fill it in and I get a nice hard selection. By the way, if you want to change your colors, there is a color palette that floats around. And you can use that if you want to. I'll just click on the little color swatch down here in the toolbar, and it brings up a bigger version of that color picker. And then I can, mess around. I can change the hue, change the hue to different colors in the rainbow. I can change the lightness, go much lighter to the left or darker to the right, and change the saturation, the vibrance of the color. So this is how I would pick this bone color. Another palette that I frequently will have open is my swatches palette. This allows me to save colors if I want. So in the swatches palette, if I go to the menu, I can say, make new swatch preset. And I can give this a name, so I can actually call this something memorable. So I call it like bone color. That's going to actually put it here in my swatches palette, and I can view these by name. So you see bone color actually shows up here in my list. And all right, I don't need that thing open. Get rid of that. So I've got one vertebra here that I've filled in. I've saved its color, to my swatches palette. Now I can start adding highlights and shadows if I want. By the way, over here in my layers palette, I had created a new layer before I started. Let me rename the layer. If you just double click on the name of the layer, you can rename it. So we're going to call this L1. In fact, maybe we can call it L1 body to be real specific, so that I remember later on, okay, which layer is the body of L1 on. And then I would probably create separate layers literally for every vertebral body in here. At this point, I have to decide if I'm going to put highlights and shadows on this thing to really give it a sense of form and some bone texture. Do I want to put the highlights and shadows right on this same layer? I know a lot of people, when they work in Photoshop, will actually have separate layers for the shadows and highlights on each object. Makes it easier to go back later and edit the highlights and shadows on that object. I'm fairly OCD when it comes to this stuff, but not quite that OCD. since I'm gonna have a million layers in this file anyway, I mean, at a minimum, I'm gonna have a layer for every vertebra. Probably have another layer for ribs and another layer for vessels and, another layer for skin. And have all these different layers. I'm just gonna go ahead and paint the shadows and highlights right on the object itself. Now, to create my color for my shadows, I'm just gonna click on this same bone color swatch. And I'm just gonna pick a darker, less saturated version of that color just by clicking farther down on the little color swatch thing here. I may even go, change the hue, just go slightly, a little bit more orangey. Click OK. I might create a new swatch for that too. Go back to my swatches palette. Call it something like bone shadow. That way, every time I illustrate a different vertebra or rib or any other bone, I have the same bone color and the same shadow color. So now is when the art comes into this, is using the brushes tool to start painting highlights and shadows on here, and even trying to give it a sense of realistic texture, bone texture. So I'll grab my brush tool, and when I choose the brush tool, if I look up at the top of the window, if the zoom thing doesn't get in the way, I've got a bunch of settings for my brush. For one thing, I've got settings for the size and the hardness of the brush. So the diameter of the brush is 20 pixels, and that's represented by the circle that you see on screen. The hardness means literally, how hard or soft is the edge of the brush. If the hardness is set to 0, it means I've got a very, very fuzzy brush that's going to paint very, very fuzzy stuff. On the other hand, if the hardness is set up to 100%, that means I've got a brush that's got an absolutely perfectly sharp, crisp edge to it. If I'm painting like just very soft shadows and things, I actually usually set the hardness very low. There are keyboard shortcuts that let you change the size and the hardness of the brush, and I use those all the time. So if you see my brush size magically changing size, it's because I'm using keyboard shortcuts. To just change the size of the brush, just use the bracket keys on the keyboard. So if you hit the right bracket, notice my circle's getting bigger, it means I'm getting a bigger brush. Hit the left bracket, it gets smaller. If you want to change the hardness of the brush, you hold down Shift and hit the brackets. Now, the problem with this is that there's no way of visually seeing how hard the brush is. It's going to still look like a circle, for an icon. And you can't even see that up here. I mean, you can see that the size has changed to 80 pixels instead of 20, but there's no way of graphically showing you the hardness of the brush. I just know that if I hit Shift and left bracket, I get a softer brush. Well, it was already set to 0, so you can't get any softer than that. But if I hit Shift and hit the right bracket, the circle grows a little bit. But if I hit it like 4 or 5 times, it'll go up to a hardness of 100%. So if I go up here, you can see it's 100%. I guess you can tell by the icon up here, it's a little bit sharper now. And as I decrease the hardness, you'll see that the little icon up here looks a little bit fuzzier. So the size of the brush and the hardness of the brush are 2 very important parameters that you want to control while you're painting. So I'll have my keys, my hand also hovering over those bracket keys to just change the size of my brush, bigger or larger or smaller on the fly. Something else that's really important to control are these settings of opacity and flow. Right now, the opacity is set to 100%, which means when I paint with this thing, it's going to paint 100% solid shadow color over that bone. Except you can see that it's fuzzy on the edge because I've got the softness set down to 0 or the hardness set to 0. But right in the middle of the brush stroke, it's 100% solid. I don't normally paint with 100% opacity. I mean, unless I literally want to just completely paint over something. if I'm adding highlights and shadows, I tend to set the opacity and flow pretty low, like down in the teens and 20s thereabouts. And I can just go in here and enter, say 20%. The flow is harder to explain. The opacity says how solid is the paint going to be. The flow tells you how long does it take for the paint to become that solid. In other words, when I'm painting with it, is it going to build the paint up very quickly and make it solid, or is it going to build it up rather slowly? If I set the flow way down low, it takes longer to build up to that 100% opacity. It'll get there eventually, but I have to keep going back over it and over it. I tend to change both of these simultaneously. You probably don't really need to, but I tend to, keep the opacity around 20%, the flow around 20% thereabouts, if I'm painting with shadows and highlights, because I want to build up those shadows and highlights gradually. There are also keyboard shortcuts for changing the opacity and the flow on the fly, which I also use. If you just hit any number on the keyboard, if I hit the number 2, it changes opacity to 20%. So it changes in multiples of 10. If I hit 6, it'll go to 60%. Now, if I want to change the flow, I hold down the Shift key and do the same thing. If I hold Shift and hit 2, the flow goes down to 20%. If I hit Shift and hit 7, the flow goes up to 70%. So I can change the opacity by just hitting any number, change the flow by hitting a number with the Shift key held down. So now I'm down to 20%. So I've got an 80 pixel brush with a soft feather edge. I got low opacity and low flow. I'm actually going to make the brush a little bigger to start with. And I'm very gradually going to rough in a shadow on this vertebra using this very large, very fat, very soft, fuzzy brush set to very low opacity and flow. And so what I'm doing is I'm just trying to establish the general form of my vertebra, where it's going to have a core shadow on the right. I'm assuming upper left-hand lighting, because we usually do that in scientific illustration. Then I'm going to drop that down in size and start establishing a little bit more of the detail of the shadows on this vertebra. Yeah.
Do you tend to always work with the mouse? You don't use like the.
I'm using the Wacom now.
Oh, yeah.
For Illustrator, I always use the mouse. In fact, when I was drawing pads earlier, mostly I was using the mouse. But when I start painting, I switch over to the tablet. So the way I would recommend it. Yeah. I think it'd be very hard to get this kind of control over painting with a mouse. Shadows, I don't know, it's looking a little gray to me. I think I'm going to try to put a little bit more color in the shadow so it's not so dead looking. I know it's anatomy, but we don't want things to look dead. We're painting living people. So. And if I get all done with this and I decide that it's still too dead looking, I can always change the hue and the saturation. I can run adjustments. At a certain point, once I've kind of, roughed in the form, I'll try to get a little bit more texture in here. I'm going to zoom in just a little bit more. To put in texture, usually go with a smaller brush And I'll actually give it a harder edge. So I'm going to hold down Shift key and hit the right bracket, which is going to give me a harder brush. And make it a little bit smaller. And now it's almost like I'm drawing with a colored pencil as opposed to drawing with an airbrush. This is going to allow me to get a little bit harder lines for some of my, to give it a little sense of texture. For any of the structures that you have to illustrate, I do think it's a good idea to consult some references for the texture of the tissue, especially something like bone or fat. You'll draw a lot of bones as medical illustrators, and so it's a good idea to have kind of an intuitive sense for what bone texture looks like. And I've always thought it reminded me a little bit of wood grain, although maybe, a little bit more subtle. But you can see that by using this harder edged brush, I'm getting a little bit of a kind of a streakiness to the bone, which is giving it almost that kind of wood grain appearance. And I may even set my opacity down a little bit lower, down at 10, so I can do this even more gradually and a little bit more subtly. And just trying to get a few little streaks in here to capture that sense of bone texture. And at this point, actually, let me do one other thing. I'm going to actually boost my opacity and flow quite a bit and go up to maybe 40% for my opacity and 40% for flow. I'm going to get a real hard edge brush, drop the size way down. And one of the distinguishing features of bone, one of the real characteristic features of bone, is the presence of what are called nutrient foramina. So bone is living tissue, and so it needs a way for vasculature to get into the interior of the bone. So all over the bone are these little openings, these little foramina. In the vertebrae, they tend to be closer to the end plates of the vertebrae, although not right out on the edge of the end plate. You may find some over here on the sides. And every bone's a little different. The location of the nutrient foramina is a little bit different on every bone. With the long bones, like say a humerus, you may have a couple in the shaft, but then you have a whole bunch of them down near the epiphyses, down near the ends of the bones. So I'm just drawing a handful of these. And they'll look a little better in a minute once I put a little highlight next to them. They vary in size and shape a little bit. All right, so I've got my bone, I've got some shadows brushed onto it. I'm going to want to throw some highlights in here too. I'm going to go back to my original bone color, but now I'm going to click on the color swatch. And what I'm going to do is I'm going to pick an even lighter version of that color. And this will be my highlight color. Not pure white, but a much lighter version of that same bone color. Might create a new swatch for this too. Bone highlight. And start painting with that. Now let me fix my brush though. I got a real hard edge brush. I want to make it a little softer, make it a little bigger. Set my opacity and flow back down to say 20% so that I can start adding these highlights gradually. Go just a little bit bigger there. So the end plates of the vertebral bodies, they stick out fairly prominently, so they're going to catch a highlight. Now, what I'm putting in right now are fairly soft highlights, what we call a diffuse highlight. It's kind of soft and fuzzy. Some things are going to have very sharp, wet, gleamy highlights, what we call a specular highlight. But not usually on bone. I mean, I tend to think of bone as being fairly dry material, again, kind of like wood. And so we don't normally put those kind of wet, shiny, glistening highlights on bone. But if I was drawing a stomach or something like that, I might not put in these soft diffuse highlights. I might instead, go for a real wet, bright white, glistening, shiny highlight because it's going to be, wet. And so now I'm actually going to drop my opacity even a little lower, get a real skinny brush, and I'm going to start dropping some little subtle highlights along the bottom right-hand edge of each of those little nutrient foramina. Because when the light hits this foramen, the light is going to hit the lip of the foramen on the opposite side. So if the light's coming from the upper left, it's going to hit the lip of each of these little openings and create a subtle little highlight that sits to the bottom right of each little foramen. Again, it really helps to, look closely at bones or closely at other people's renderings of bones, and same thing with fat, and gradually develop your own approach. I've done this enough times that I've kind of got a formula for it that I follow pretty much every time that I do this. So, there's a bone, and from a distance, you see that kind of wood grain texture in some of the nutrient foramina. Now I would repeat this all on different layers. I need another layer for, this is, I thought I labeled that. This should be L1. I need another layer for T12, although if you look at the image, you'll see that L1 is actually kind of overlapping in front of T12 a little bit. So I'd actually probably reverse the order of these layers. I'd have L1 layer above T12. So on the T12 layer, and I won't do the whole thing, but just to give you an idea, I'd select the path for T12 that I had already drawn previously, go to the little menu in the paths palette and turn that into a selection. So now I've got a selection for the T12 vertebral body. Make sure that I'm actually painting on the correct layer. Make sure I'm going to paint on the T12 layer. Select my bone color from my swatches palette. Go to the edit menu, fill it with foreground color, grab my shadow color, go back to my brush tool. Sometimes it makes sense to do all your shadows at once. Like, I do the shadows on L1, jump and do the shadows on T12, jump and do the shadows on T11, and so forth, all the way up the vertebral column. The only reason for doing that is that you don't have to keep changing your brushes and remembering, gee, how big was the brush that I was using? What was my opacity and flow? you could actually have all of your, just fill all of your vertebrae with this flat yellow color, and then come in here and start painting, and then come in and start painting the shadows, and then like drop down to your smaller brush. So sometimes it's more efficient to do everything at once. Do all your shadows on all your bones at the same time. Do all your highlights on all your bones at the same time. All right. So I mean, I think you can tell it's going to take a while because I got a lot of vertebrae to do. And, I may choose to put in ribs. Plus, I got a lot of internal anatomy. I got heart and big vessels in here. I go to my my other layers, and like there's my heart and my aorta. I might choose to hide these vertebrae layers that I've already. And I'm going to deselect to get rid of that selection. I might choose to, hide those layers temporarily while I work on the aorta layer. But once again, I do something similar where I would just draw a path, and I'd probably go ahead and include these big branches off the aorta. Try to do this with relatively few anchor points to make sure I get a nice smooth path that's easy to edit. I can even go beyond the edge of the image and draw anchor points down here. Those won't appear in the final image. I'm going to go ahead and draw the base of the aorta, even though you can't see it in the image, because I know later on I'll come in and I'll paint that pulmonary trunk in there as well. And that's just going to cover over the aorta, but it's easier to just go ahead and draw it now. Once again, with my work path, I want to make sure that I double click that and give it a name before I forget about it. Turn that into a selection. Go to the little menu in the upper right, say make selection. Make sure it's got a feather radius of 0. I'm going to paint the aorta on this layer. Make sure I'm not painting the aorta on the same layer as one of my bones. So for something like the aorta, I'd pick, I go to my color picker and I choose red. Oops. Go with a red somewhere around here, maybe a teeny bit lighter. Fill the selected area with 100% of the foreground color. There's my aorta. And I suppose I could save the swatch in case I need to draw other vessels later. And then I would grab a shadow color, just grab a darker version of that, maybe go a little purplier. I have to kind of go up here to the other end of the rainbow, but maybe something that's a little purplier and quite a bit darker. This is going to be a little tricky. Got to have a pretty steady hand for this. So just because I don't have a steady hand, that's one of the reasons I work with my opacity and flow very low, so that if I screw up, it's not that bad. But I'm going to come up and very gradually work in this core shadow to make that aortic arch look a little bit like a tube. Notice I'm not painting the shadow right up against the right-hand edge of the aorta. I'm leaving a small area of reflected light. I'm painting a little bit of a shadow on the left, just because it's going to have a little shadow as it starts to recede into the background. I'm going to then have my core shadow over on the right. Again, I'm not painting that core shadow right up to the right-hand edge. So I'm leaving a little of the lighter red showing through as a reflected light. Because having a reflected light on your objects is one of the things that really makes it look three-dimensional. You know, anybody can put in just a highlight and a shadow and a midtone, but leaving that little reflected light on the far right actually accentuates the three-dimensional appearance. So then we get a little narrow up here where these small vessels are. I got to go down to a much smaller brush to put core shadows on each of these. Even a little smaller for this carotid. I'm doing this fairly quickly for the sake of the demo because I don't want you to be completely bored to tears, but not that much quicker than I would normally do. Just, you know, like I started to say this before, you develop a technique, you develop kind of a formula for doing this, and you know, once you develop your confidence in doing it, you can approach these projects and crank them out pretty fast. All right, so there's some shadows. I'm going to pick a highlight color, go back to my, I never did save a swatch for aorta shadow. Let's do that. Oops. Does this class end in like 6 minutes? Wow, I didn't realize I'd taken that long. Okay, I got to show you one other thing before I run out of time completely. So what do we got here? We got an aorta and a couple of vertebrae. I'd have to, you know, throw highlights in there. I'd have a bunch more to do, but last thing I want to show you here is we're going to do the skin, and I actually have this, not exactly the same project, but I actually have something from the Mannix data set, that I had done for a different demo for this class. I've got, you know, here's my skin, very similar to what I had before, although down in the abdomen instead of up in the thorax. And so using that, I drew a path, which you can see there. There's my body outline path. So just drew a path the same way I did, you know, for the bones and for the aorta, and turn that into a selection. And fill it with a skin color. Let me just pick something that will pretend is a skin color. And I need a new layer. Fill it with 100%. Throw some shadows on here, and this is going to be super quick and dirty. This is going to be awful, but we're going to just throw, you know, let me boost my opacity and flow a little bit. All right, so we'll just throw some shadows in here on the body. There's my skin. Looking really bad. You get the idea. Hopefully, and there's a groin down here somewhere. So there's my skin. Well, I've got a whole bunch of other anatomic structures that I had drawn. I'm going to drag the skin way up here. I've got a whole bunch of other anatomic structures that I had already drawn, but I can't see any of them because my skin's in the way. This is how I would like you to approach doing the skin. I would actually have the skin be the very top layer. But what I'm going to do is, well, let me show you one way you could approach this. You could take the eraser tool and you can actually choose a size and a hardness for the eraser tool, just like a brush tool. I can make a great big fat eraser. You can even change the opacity of the eraser. Let me change it to, I don't know, 30% or something like that. And with this giant eraser tool, I could start erasing the skin to gradually reveal the anatomic structures inside. That works, but I'm going to show you a better way. Rather than using the eraser tool, I'm going to use what's called a layer mask, which is one of my favorite things in Photoshop. So I've got the skin layer selected, layer 5. We'll call that, let's rename that, call that skin. There is a way to add it from the layers palette, but I'm going to go up here. I've got my skin layer selected. I'm going to go to layer, layer mask, reveal all. Notice what that's done over here in my layers palette. It's added this little white box next to the image of the skin, the little thumbnail of the skin. I'm going to start painting with black. And I'm actually going to be painting on the mask itself, not on the skin layer. Any place where I paint with black on the mask. All right, you're making a liar out of me. Oh, that's because I got my eraser selected. Never mind. Let me go to my paintbrush tool. Anywhere where I paint with black, what it's doing is it's masking the skin layer to reveal the anatomy on the layers behind. Now, the end result doesn't look any different from when I was using the eraser tool just a minute ago, but there's a huge important difference. With the layer mask, if I decide later that I don't like this, all I've got to do now is paint with white on the mask, and it puts all the skin back on. So the beauty of the layer mask is it's not permanently erasing the pixels on the layer, it's just temporarily hiding them. So I can switch back and forth between painting with black and painting with white. Paint with black, it masks the skin layer to reveal the anatomy behind. So I can reveal as much as I want and hide as much as I want. And if I decide, I don't like that, I just start painting with white, and it undoes it and starts, hiding the other layers again. So, so that's a layer mask. So you just select the layer, and here's what I had done previously in a demo, similar kind of thing. I had drawn the skin and then used a layer mask. You see the layer mask here for the body to make most of the skin transparent to allow the anatomy to show through. Okay. Sorry to talk so long.